Welcome back to TV5 News at 9. Medicare open enrollment is underway, and Genesee Health Plan is here to help you with the process. Joining us this morning to tell us more, we have Enrollment Coordinator Jill Alexander and Michigan Medicare Assistance Program Director Uratile Sijiye. Good morning, ladies.
Good morning.
Good morning.
So Genesee Health Plan wants to hear from you. First, you can scan the QR code on your screen to fill out a survey about your health care coverage. You can see the QR code there now. There will also be a drawing to win a $25 Visa gift card from Sovita Credit Union, so fill that out. You can also find it by going to the contest tab on our website at WNEM.com. But now back to today's topic. Jill, how long can we access Medicare open enrollment for?
Open enrollment is actually now until December 7th. So even if you're happy with your 2024 plan, we highly recommend that you at least talk to somebody or log in if you feel comfortable, and just make sure that there's no changes for the 2025 year. There are lots of upcoming changes to those plans.
Good to know. And can you explain what Genesee Health Plan is doing in Bay, Genesee, and Saginaw counties to help community members with enrollment and what that looks like?
Sure. Myself, along with 5 other counselors, are certified in Medicare Marketplace and Medicaid enrollment. So we take pride in kind of taking that unbiased approach, not just zoned in on one insurance company, where we can kind of cater to our community's needs.
And Rati, what is Medicare fraud, and why should people be cautious?
All right. Medicare fraud occurs when providers that are charging Medicare, billing Medicare for services that they should not have been billing for, services that they didn't provide, or they're billing for more than the services that they provided, and or billing for services or dual medical equipment that have not been provided to the beneficiary. Now, we should all be concerned about Medicare fraud because it affects all of us. We pay into the system hoping that in the future it will serve us well. But when Medicare waste happens, the Medicaid is spending more money paying to the wrong people. So Medicare beneficiaries, their family members, and their care providers are the first line of defense in being able to stop Medicare fraud. So we pay into the system. Medicare beneficiaries should be receiving good care, but Medicare is not able to do that because a lot then is wasted on it. Nationally, there's about 60 million people on Medicare. In Michigan, we have about 2.2 million people in Medicare. So when we looking at waste, we're talking about almost $60 billion wasted on unscrupulous billings to Medicare. So we're all invested in making sure that only the right providers are getting paid for these services.
What are some of the warning signs people can look out for?
So some of the warning signs that people can look for is phone calls. When you start receiving those phone calls that are unsolicited, they're looking for information, and that information usually includes your name, your address, your doctor's office, and it looks like it's harmless. But then when you add your Medicare number to that information, then it also leads to medical identity theft. And some of the warning signs are unsolicited visits that people may be getting. Now that we're looking into open enrollment, you're looking at also sales pitches. You know, people are being pressured to change plans that are not the best plans for them, as Jill was just talking about.
Some good reminders for sure. And how can people report fraud if they suspect it?
So at the Senior Medicare Patrol, our phone number is 1-866-MICH-SMP. We have volunteers that are available to assist people to report fraud. So we will be, let's say, if you receive any services and if you have any contact information for these actors, we will ask for that information, and we'll work with the Office of the Inspector General to make these reports to them.
Awesome. And once again, we mentioned that survey people can fill out on our website. Those watching can also scan the QR code on our screen right now. Jill, once again, can you tell us a little more about this survey?
Yes, so we have an upcoming event we're really looking forward to. We have some community partners who also enroll members in our community, and we kind of just want to gauge what the community wants to hear from us. So we highly recommend that everyone participate,
Yeah.
so we can actually talk about what people are curious about.
For sure. Ladies, anything else I'm forgetting that you'd like to add? Anything else people should know?
We do highly encourage Medicare beneficiaries. Like I said, we're the first line of defense, whether as a taxpayer, as a family member, as a care provider, we're all being targeted and we're all facing the consequences of Medicare waste. And instead of services that are being improved, money is going to the wrong actors. So we encourage people to look at their Medicare summary notices, to look out for those charges that they don't know, it's doctors' names and services that didn't receive, or if they receive packages that they didn't talk to their doctor about and they don't know anything about them, call the Senior Medicare Patrol and we'll, with our volunteers, we'll be able to help guide them on how to report.
Perfect. Well, Rati, Jill, thank you again so much for being here. TV5 will be live with Genesee Health Plan on Facebook later this morning at 10 to answer any questions you might have. In the meantime, you can also find more information on our website. Just click on the hot link section on WNEM.com.